Chief Exec of Care England, joining me now. Hi, it's good to see you. Thanks for joining us on the programme. What challenges is the care sector facing?
We have a serious funding shortage, and we also have a serious workforce shortage. So Skills for Care data showed that there were 154,000 vacancies in social care, and that was up 52% on their previous data. So I think you'll see that not only have we got this funding crisis, but we've also now got a workforce crisis, and that's going to mean that people are not going to get services, and that's going to put huge pressure on families and local services, particularly local authorities.
Why is that?
Well, I think it's down to money, Kay. The bottom line is that there is not enough money in the system. Our colleagues do the most amazing work and they have a very skilled job to do, but they're not paid appropriately. We don't have a workforce strategy in social care where there is a workforce strategy in the NHS, and we're constantly competing with the NHS, but we're not given either the money or indeed a workforce strategy so that people can know they can have careers in social care.
Increasing the basic wage, which is what is one of the ideas that's been floated as part of the autumn statement, how would that help? Because that's suggesting that those wages would increase by 10%.
Yeah, I think we should remember that this is a very complicated job, and I think we need to put the people who work in social care on a different footing. So it's not about just increasing the wage, which is pretty inadequate at the moment, by 10%. It's also about saying we need to have a proper career structure, and people need to know they have careers in social care. There might be an entry level, but they know that they can quickly rise up the ladder and get a lot more money and also a lot more training and development. So I think it has to be part of a long-term workforce strategy.
Social care crisis, what impact does that have on the NHS? Because we're hearing that a lot of people who are in hospital, don't need to be there, but there's no support for them if they come out of hospital.
Yeah, it's having a huge impact on the NHS, and as you say, there are people in hospital now who don't need to be, but the reason they're there is because they can't get social care packages. But of course that's the thing that gets the publicity, but there are about 10 times as many people in local areas waiting for social care assessments and services. So it's not only a problem for the NHS, but it's also a problem for people who are not getting the support they need. And what will happen to those people is they'll go into crisis and probably go into hospital, and then that compounds the problem in the NHS.
And so has the social care service always been a Cinderella service?
Yes, it has, unfortunately. You know, we've never really had the same status as the NHS, but we are an absolutely integral part of a health and social care sector. And what we need to see is parity of esteem, we need to see pay and conditions aligned, and we need to see social care respected, particularly because it does a very complex role. And the same people who are in the NHS are the same people who are in social care.
And do you envisage potentially industrial action, as we're seeing increasingly in the health service, in the social care service?
I don't think we'll see industrial action, but what we will see is care staff walking and getting other jobs because there's higher pay and they're less difficult jobs. So in effect, what we'll see is a reduction in the amount of services available. So it won't be quite as stark as industrial action, but the impact will be enormous.
Okay, it's good to talk to you. Thank you so much for taking the time to join us in the studio